South Korea's daily cases have been hovering around the 600s for some time, and this is causing cases of critically ill patients to rise too. This comes as the health authorities are planning to change the current social distancing model. Do-yeon has the details.
With cases hovering around the 600s for several weeks, the number of critically ill patients may be starting to rise as well. There are currently 156 patients that are under intensive care, as 24 more became critically ill on Tuesday.
The number of critically ill patients and deaths rises 1 or 2 weeks after daily cases increase. So with a relatively high number of cases for some time, critical cases and deaths could see a rising trend. To prevent critical cases as much as possible, we will strengthen the treatment system and preventive measures at high-risk facilities.
This comes as government has set this week as a special virus prevention week and is assessing the current measures to possibly update the distancing model starting next week. With the growing number of critically ill patients and the medical infrastructure's capacity directly affecting the distancing model, the government is being cautious in the new updates. As for the daily number of cases, the country reported 512 new cases of COVID-19 on Tuesday, of which 477 were local transmissions. The numbers on Mondays and Tuesdays are usually lower than the rest of the week, and by midweek, the cases could rise into the 700s if they follow the trend seen in the past few weeks. Currently, cluster infections are down by 15%, while these individual infections account for almost 45% of infections, an all-time high for the category. The country also reported 86 more variant cases on Tuesday. So far, there are a total of 535 cases of the known main variants, and the variant first found in the UK accounts more than 460 of those.
To figure out the best isolation period for the variants, we analyzed the transmissible period of the UK variant. As a result, the transmissible period for the UK variant was no different from non-variant cases.
With the findings, the authorities said UK variant patients will no longer have to undergo a longer isolation period than non-variant patients. Do-yeon, Arirang News.